Hey, good afternoon. My name is Melissa Grace, and I'm here to talk to you about my ideas on how to teach antimicrobials effectively to undergraduate nursing students. When I was researching this, it seems like it'll be a pretty lengthy course. There's a lot of medications that follow underneath this heading, so I allotted 12 hours, which would probably take a week or a week and a half, depending how often you lecture. The first part of my teaching plan is going to include the students having done some pre-work. This will kind of help them assess their baseline knowledge on the topic and to get 3 chapters of reading in before we meet for class. This will allow us to openly discuss some things they've learned or maybe didn't know were covered under antimicrobials, so we have a way to go from there. I also want to incorporate technology along the way as often as possible, so I did insert several YouTube videos into my teaching plan. I think those make it more fun and visual for the students and kind of incorporate technology in our learning just to change it up a little bit. I don't really care for a straight lecture personally myself, and so I wouldn't plan to teach that way in the classroom. After assessing for baseline, we're going to talk about forms the medications come in. These, of course, will include oral, IM, IV, and topicals and nasals. I think that it would be a good idea to have examples of each of these types of medications. Antimicrobials, of course, there's a lot of medications that fall under there, some of those being over-the-counter, household items, all the way to prescription medications. So I think it would just be good for tactile reasons for patients and for students to be able to put their hands on some of the items and kind of see how they come as a good idea. There will be another video there as well. After we talk about the different forms the medications come in, that leads us right into how do you administer these, what site. So the rights of a medication administration and the routes at which we administer them are important through nursing throughout, so it really applies to so many different things. Here I found a YouTube video, Call Me Maybe, which I think is very current for our students and a song they would all recognize, but it goes over each different route that you would assess for before you start to give the medications. Also, we'll do skills lab as our hands-on for this function. I think that this helps students role play and have students pair up, groups of 2, possibly more, depending on the class size, where someone is the provider and someone is the patient. I think this will help build comfort in how to speak with their patients, how to ask the right types of questions, and how to understand that all those rights need to be met and how important they are. This also allows our students to understand site location as far as, IM injection sites, and to kind of have some mannequins present, hopefully, to let them actually put their hands on. I think so many skills can get lost during lecture, and you can show lots of pictures and videos, but I think actually taking them into the skills lab and letting them put their hands to different items and to touch actual pieces of the body really give them a feel for what they're going to do when they're putting that into practice. The next part of my lecture will be over the actual medications themselves, and I'm going to break that down under antibacterials, antifungals, antivirals, antiparasitics, and then non-pharmaceuticals and drugs that are considered like over-the-counter and antiseptic, household cleaning products, those types of things. After we review the medications that fall underneath these broader categories, I think that it would be good to to play a game. So I had the idea that we would have like a poster board with the name of each type, and that the teacher, and at some point I think the students can teach the teacher. So the teacher or a student would go to the front of the class and list out the name of some of the medications, and then the other students, who would be the audience or game show players, could lift up poster boards with the name of what they think that particular product is. This would be a good way to familiarize themselves with the product and kind of incorporate it, making it fun, a fun way to learn. And then you can repeat this game, of course, throughout your lecture to build up knowledge base and to see where someone is still lacking or maybe confused, where they might not truly understand what the drug follows under. After that, I'm going to talk about the importance of taking a good history. When we do our physical exams, we do get lots of information like vital signs and blood pressures, heights and weights, so all that will be included. But how important it is to really talk to your patient and not at your patient. I think that can be a common thing people do, just looking at a list, but we want to really talk to our patients, everything about their family history, their concerns, allergies, simply the way they're sleeping at night, medications they're using, to assess what is going on with them. We will also go over, of course, lab values and possible diagnoses. Although nurses do not diagnose, we do help support the educational process of helping patients understand their diagnosis, how to plan with our patients, and incorporating some education there. So I think that a good way to accomplish that is to explain the importance and, of course, show some videos that are good representations of how to take a history. And then again, we can go to the skills lab and we can have students do mock intakes of patients at different levels, children, and practice different patient scenarios you could come across. Perhaps you have a patient that doesn't speak English. Perhaps you have a patient that has dementia and you need to include the family member, and discuss on the purpose of including materials with them. So I think that we can incorporate all that into our teaching style so our students know how to carry that over to the actual workplace. After we've covered all of these different things and used our skills lab heavily, our supplements heavily as far as playing the game, and a lot of videos to be incorporated, it's when it would be really important to assess what the student has actually learned. So we would review all of the information in a question and answer format. I would consider incorporating like a mock test here. I also would consider incorporating a teach the teacher, where I would sit down and let students, break down and say, I need someone to come up here and teach me about antibiotics. What do I need to know? As a way to make sure that the volume of information they receive is not just a memorization type of thing, that they can actually in turn teach me, that they have a true understanding of what we gain. Of course, we might come across some areas where the students are weak or there was poor understanding. At that time, I would wait and kind of review those areas to make sure we're on the same level. We would also discuss some NCLEX style questioning. It's never too soon to prepare for the NCLEX, so with each situation, each lecture that we're teaching, we would include that kind of formatting, so students are building up that base knowledge of understanding how those questions are written, how they appear, and how they should appropriately break them down to derive at the most correct answer. The very conclusion of my teaching plan is a test that requires an 80% score to pass. And then I think that, I would include maybe one extra challenging bonus question as a way to give students an opportunity to kind of help their grade out a little. And of course, we're going to have all different types of learners in our classroom, and there's so many good teaching strategies. So I would just try to adjust my plan as I go if I see that a student's maybe not getting it or struggling in a certain area, or maybe if the students are really responsive to the game playing more than just the videos, then I would try to, maybe lean a little more towards that, or as I tackle that lesson again the next time we meet, incorporate more of what they're responding to so that each student can have success. So these are my ideas on how to successfully teach antimicrobial therapy. Thanks for watching.